That's all right. We're going to be looking at a few natural remedies that you can use. And one of the first ones that we're going to look at is the onion. And I think every home has an onion. And this is the first poultice that I ever did. And my first daughter Emma, I think I mentioned in another class, she had an earache, and over 6 weeks and 4 courses of antibiotics, and the earache kept coming back. So when my next child had an earache, I didn't go to the doctor. It's a very scary thing to do. I didn't want to hurt my child, but I didn't want to go through that again. So I went to the old lady next door. I must have been about 25, she's 85. I said, what did your mother do when you had an earache? She said, Mum would steam up an onion on the stove. I ran home, I steamed the onion on the stove. You can steam it or you can dry bake it, and you leave the skin intact because that holds it together. And then you cut it in half, and then you wrap it in a cloth. Now remember, I didn't know what I was doing, but I didn't want to go through 6 weeks and 4 courses of antibiotics again. So I cut the onion in half so that, and remember this is hot, and then I wrapped it in a cloth. And I think you call it a dishcloth, use it just a tea towel. I wrapped it over a few times so there were a few layers, and tried it on my hand till it was the right temperature. And my son, he was 18 months old, he was breastfeeding at the time, so I was able to put it next to his ear and I could feel it with my arm. And he was breastfeeding, you can do anything to him. And he fell asleep. So that told me that it did bring him some relief. And then I folded up a big towel and I laid him down so that he was on the onion, and I knew the towel would insulate it. You can keep the onion there as long as you can keep it warm. So what you can do is you can put the onion on the ear and you can cover it with a piece of plastic. See, what the plastic does is it insulates it and it keeps it warm. So you keep it there as long as you can keep it warm, and then you could bandage that on with an ace bandage, or you could put a woolen snug-fitting beanie on there. Some people choose to lie down and sleep with it on. So as long as you can keep it warm. So my son slept for 2 hours, and when he woke up he was happy, and I watched him for the next few days and he was perfectly fine. No wonder I went into natural remedies. 6 weeks, 4 courses of antibiotics, and a 2-hour onion poultice on the ear. I was impressed, and that's when I began a journey of investigating, is there other things out there? And there was, 150, 200 years ago, these simple natural remedies were passed down from mother, grandmother to mother to daughter, and were well known. But when allopathy and drug medication became the number one, well, basically all that was forgotten. I have a friend in Serbia, and his father was a doctor, and he said whenever we'd get sick, my father would not give me medicine. He said he'd put onion poultices on it, and we'd say, Dad, we want something scientific. But he said, no, he said, you're going to have this. Isn't that interesting? He was the medical, he was in Slovenia. No, he just used natural remedies on his children. So this was my first poultice that I ever did. And what I have since learned, that when it's hot, you can squeeze it and put a few drops into the spoon. Remember, it's cooked. It'll be boiling hot, but the spoon will be cold, and so as the drops go into the cold spoon, it warms it, and you can put that in the ear before you put the onion poultice on the ear. If the earache comes back the next day, what do? You put another one on. That's right. Now, a friend of mine, her earache kept coming back every day. So you know what she did? Put another onion poultice on it. Put another onion poultice on it. After 5 days, how many people would go, I've got to go to the doctor? Well, what are you going to do? What's he going to do? Just give you antibiotics. She said it took 7 days, and on the 8th day, there was no earache. You see, see, your body knows what to do, and if it takes one application, or 5 applications, or 7 applications, you will not have your earache forever. But that is just as long as it takes. And sometimes it just basically helps the body to take the inflammation, the pus away through the bloodstream, or sometimes it'll make a hole in the ear and the pus will come out. Do you know, whatever the body does, that's exactly what it's meant to do. That's why trust the body, listen to the body, and just follow it. So what Jessica's doing now is she's slicing up the onion, and she's going to make, and we're going to make an onion poultice for the neck. So if you could finely slice those bits. So what I usually do is I finely slice it. Now, just a fine cotton is the best thing for the poultice. And what you do is you finely slice the onion for this, and you just put a couple of layers of the onion in a cloth, and then you fold it over. So I've got a few layers of, maybe I've got about 10 little fine slices of pieces of onion in that, and then you put it on the throat. It's happened before. And then you cover that with a piece of plastic, and then you put a bandage on it or a scarf to hold it there. You could sleep with it all night. Your bed partner might not like the perfume that night. But it brings great relief to a sore throat. One lady said to me, oh, my daughter was very hesitant, but her throat was so sore. And she said within half an hour it went from about 9 out of 10, razor blade sore, to about a 5 out of 10. So it's not going to take it away like morphine might. It'll ease it. It'll ease it to make it bearable. One lady said to me, my daughter's got strep throat. And I thought, where did this strep throat come from? When we were little, it was sore throat. But now they call it strep throat. And the mother said, I've got to take antibiotics because the doctor said if I don't, it'll go to the brain. Where'd that come from? We've had sore throats for centuries. We all had sore throats. I'm sure there's not a person in the room that hasn't had a sore throat. And if you didn't take antibiotics, did it go to your brain? No, that doesn't make any sense at all to me. But this brings great relief, is just putting the onion on. And it's definitely a part of the body healing with a cold. In the 1940s, they opened the Common Cold Research Unit in Salisbury, London, to find the cause and the cure of the common cold. Well, after 40 years, they closed down in disgrace because of a total inability to find the cause and the cure of the common cold. They never will. Because do you know what a cold is? It's a house clean. It's a house clean. And if you give it the right conditions, your house clean might only last 24 hours. How do you give it the right conditions? Hardly anything. Drink lots of water. Now, Jessica's going to write on the board for you the flu bomb. Yeah, she knows the flu bomb. So you can take the flu bomb. What's the flu bomb? It's just really a pretty fancy lemon and honey drink. And when we were little, what did our mothers give us when we had a cold? Lemon and honey. That's all you need to do. We weren't, I know when I was a child, we weren't rushed to the doctor when we had a cold. We just let the cold run its course. Now, if you have a lot of sugar, if you're up half the night and you don't sleep well, you're not drinking enough water, and you're eating a lot of junk food, that cold could last for weeks. But if you give it the right conditions, then that cold can pass through your body very quickly. So Jessica's chopped up a whole lot of onions here. Actually, while she's writing that, I'll explain the flu bomb. You could call it a COVID bomb, or you could call it a cold bomb, or you could call it a pneumonia bomb, or you could call it a sinus bomb, or you could call it a strep throat bomb. And it's a fairly fancy lemon and honey drink. And the first and then 1 clove of garlic crushed. It can be a big fat clove or a little clove, whatever you can handle, but you crush it. And then about 1/4 of an inch, is that what you did? Oh, 1 inch, no, 1/4 of a teaspoon. She's just going to adjust that one. About 1/4 of a teaspoon, inch, oh, okay, inch, right, 1/4 of an inch, grated ginger, very fine, and then 1/4 of a teaspoon of cayenne pepper, and 1 drop of eucalyptus oil, and also a teaspoon of honey. Yeah. So you can see it's just a lemon and honey drink that's got garlic and ginger and 1 drop of eucalyptus oil. One lady bought a bottle of eucalyptus oil. She said, I cannot use it. I cannot use it for the flu bottle. And I said, why not? She said, because it says on the bottle, not fit for human consumption. We're not asking you to drink the whole bottle. It's 1 drop. And in Australia, you can get eucalyptus cough drops. What do you think's in the cough drops? Eucalyptus oil, that's right. Now what I'm about to do, and we're going to pretend that Jessica's hand is a foot. And you can do this for a cough, especially a night cough, if someone's coughing at night. You put chopped onion in a cloth, and we're going to pretend that Jessica's hand is a foot. And then you put that over like that, put a plastic bag on it, and put a sock on it. And that onion is touching the bottom of the feet. It's quite incredible the effect that has. There'll be no night coughing. So I was with one of my daughters, and her little boy James, he was 3 and he just coughed and coughed. We gave him a hot bath, we gave him a hot lemon and honey, put him to bed, and for half an hour he just coughed and coughed and coughed. So we got him up, chopped up an onion, wrapped it on both of his feet, put him back to bed, not 1 more cough. Did not cough for the whole night. It's quite incredible. The biggest pores on the whole of your body are on the soles of your feet. And so this chopped onion on the soles of the feet, the blood's taking it up and it takes it exactly where it needs to go. You can also just put the chopped onion into a sock. Sometimes that's easier. And then put a plastic bag over that. What the plastic bag does, it's not really touching you, it just protects your sheets. And then put another sock over the top of that and it'll hold it all in place. And now we're going to do a onion cough mixture. So I'll get Jess to put this together. This is a really old remedy and it's so easy. It's about 1/2 inch of chopped onion, and then about a teaspoon of honey. And I always like to use the unprocessed honey. Then another about 1/2 inch. Now I'm going to ask for a volunteer to wash this potato for me. Can someone go and wash this potato? Because it should be washed. It's got dirt on it. Thank you very much. It just needs a wash. Thank you. Thank you. So she's layering it up, a teaspoon of honey and about 1/2 inch of, it's not coming out very quick, is it? I need to put that knife in there. And so you layer it, honey, onion, honey, onion, honey, onion, and right at the very top, I usually put a good 2 teaspoons of honey. Now this is one of the first things we're doing because by the end of this class, an onion syrup will have begun to form. Now this is obviously very good quality honey because look, it won't come out, it's not a bit solid. Jessica's going to dig it out. That means it's a good quality honey. Do you know a lot of honeys that you buy in the supermarket, they put sugar syrup with it, or glucose syrup. So we're going to put another layer of onion. When the children were little, I used to buy a big bucket of honey, lasted about a year. And in the winter, it'd go total solid, almost harder than that. Thank you. A plate. Yes, thank you. So we'll put another layer, and this will be the last layer, so we'll put about 2 teaspoons of honey right on the top. So if you really needed a bit of onion syrup quickly, within about an hour, you've got the syrup forming. So you can see that honey is quite thick, and the syrup that formed is quite runny, almost like water. It's just like a golden colour. So after 24 hours, you let that sit 24 hours, and then you strain it. You strain the onion out, and you can keep that onion syrup in the fridge for probably indefinitely. Never lasted in my fridge very long, because my children very much liked it. And if you don't give your children candy, they like it. And it's really nice presenting your children to the world at the age of 16 with no cavities in their teeth. You know, one lady said, "Oh, you deprive your children of sugar?" Yes, I deprive them of cavities in their teeth. I deprive them of swollen tonsils. I deprive them of having to get their tonsils out, having to get their adenoids out. You know, there's a poem called Choose Your Heart. But we had desserts a couple of times a week. You can make beautiful desserts, as we are very glad for the desserts that we've seen here. And if it's not sweet enough for you, you can put a little bit more honey in it. But at the moment, if you tip that, you will see that there's no syrup. There's no syrup at all. But by the end of this class, you will see a syrup begin to form. Now we're going to have a look at garlic. And garlic, garlic is a very potent antibiotic, and you see in the flu bulb, it's an important part. Now, one other thing that goes in the flu bulb is probably half a cup of hot water. And when you've got a cold or a flu or sinus, you can have a flu bulb 3 times a day. And it's quite possible in a couple of days you won't have your cold. If someone says, "You taking an antibiotic?" you say, "I sure am. There's God's antibiotic mix." And they're all heating herbs, so they help the body to fight whatever you're fighting. But you can't give that to a baby. There's something you can do to a baby. I've done this many times, and I usually cut up fine cotton. Now, in Walmart, I have seen, I think it's potato sack, flour sack, flour sack cloths. And they're fine cotton, because I have done these classes and we've been able to get that. And I really like that fine cotton. I haven't got it here, so we're going to just use a piece of paper. You can finely slice garlic and lay it on the cloth, and then fold it over, and then you wrap that on the foot. You can put raw onion straight on the skin, but not garlic. If you put the slices of garlic on the skin, it'll cause a blister. And we try not to do that. But I used to put this on the bottom of my baby's feet whenever they had a cold, and it helps to clear the airways, helps to loosen the congestion on the chest. The cold can often last a week, and if they get a cough, they can be coughing for a couple of weeks. And some mothers get very upset. I said, every baby in the whole wide world has had this. It's all right. It's actually part of building up the baby's immune system. And if you give your baby the right conditions, the baby will recover quite But slicing the garlic, wrapping it on the bottom of their feet. Remember, don't let the slices of garlic touch their skin or all this stuff. So this is particularly something that I used to keep for babies. Did you know once you wrap that on the bottom of their feet and then you can put a little sock on them, you can smell the garlic on their breath in a couple of minutes. An indication that the garlic is in the body. And Jessica has just grated up ginger. We're going to have a look at what you can do for ginger. One of my favourite teas is a ginger tea. And to make a ginger tea, you just finely grate it up and pour boiling water on it. But what I'm going to do now is make a ginger poultice. To make a ginger poultice, and ginger is the best poultice for joint, for inflammation of the joint. So very good for arthritis, for gout. And to make it, I fold over the cling wrap a few times, so I've got a square here. I'll put that on the plate. And now I've got a cloth, and that's a good size of cloth. That'll be about 10 inches by 10 inches. And now we're putting the ginger. We spread it out on the cloth. So you'll see I've got it on the cloth like this, and I'm about to fold it up. And when I fold it up, I'll make the poultice. So I wrap it over top and bottom over, and then the sides over. And now I have a little package. And you can see that the juice is starting to come through the package. And let's just pretend Jessica's been massaging too much and her wrist is sore, so I'll put that area where it's got the juice on it straight onto this painful joint, and then I'll cover that with the plastic. What the plastic does is it insulates it, prevents chilling, and it stops spoiling your clothes. And then I'll bandage that on with a bandage. Just a word of warning, if your joint, whether it be your wrist, your knee, your hip, your toes, your fingers, if it's very inflamed, within half an hour the skin gets very hot. So if we're going to do it overnight on a guest, we will make the poultice about 6 o'clock. And we'll put it on at 6 o'clock, then at 7 o'clock we say to the guests, how does it feel? And some of our guests have said, it's burning, I can't bear it. So you take it off. Because the fact that the skin's burning, that tells you it's already taken some inflammation out of the joint. And when you take it off, there's no redness, there's no apparent discomfort to the skin. But I said to the lady, she said, oh, that was burning. And I said, yeah, but how does your wrist feel? And she said, oh, actually I can move it. And I don't have the pain in there anymore. So sometimes the person can get totally distracted with burning on the skin. Now, if the person says, I can't handle it, you just take it off. Because there's no hard and fast rule here. If it's burning you too much, take it off. One man, I put it on his knee, said at 6 o'clock at night, and at 7 o'clock I said, how does it feel? And he said, very, very good. He said, it's very, very warm, but it feels so good. He said, can I please keep it on? I said, certainly. And so he slept with his all night. Can you see an important part of being the doctor is listening? Now the lady that said, I can't bear it, take it off. Next day, we'll put it on for another half hour. Maybe half to half, and now she said, I can't bear it. I said, it's already done something, and you can tell because there's not so much pain in the joint. And what we found with her, every day, the heat on the skin got less and less and less. It appears that the ginger pulls the inflammation out of the joint to the skin. And you'll see now, there's quite a bit of juice coming through, and yet this cloth is fairly thick. So if you've got a very thin sack cloth, so flower sack, It comes through even better when it's really, really cotton. And what I used to use is the sheets, because when you've got 6 children, the sheets do get thin, and they're really nice and soft and really nice and thin. And on a rainy day, get all the kids sitting around and tearing up all the sheets into sizes like this. It's a good idea when you go home to make yourself a poultice box where you have cloths, different size cloths, ready for when there's a problem. So what I did here was I made a ginger poultice, and remember, ginger's for joint, sore lower back. If you've overdone it, maybe you haven't been engaging your core and using your quads and your femur muscle to bend, and maybe the back is sore. This on the back brings a lot of relief. How long do you keep it on for? As long as you can handle. But if it starts to feel really burny, just take it off. One lady who had very, very delicate skin, she put it on her hip. She only had it on for 3/4 of an hour, and when she took it off, there was a rash on her skin. And she emailed me and she was very upset. She said, "You never told me it would do this." Well, I've probably done it hundreds of times and I've never seen that. So what does that lady do? She probably puts it on for 20 minutes. So you just got to listen to the body. But I wouldn't put it on again until it had totally healed. Now before I show you the potato poultice, can you make a square about this big? I'm going to castor oil. What's this one? Castor oil. We've been talking a lot about castor oil this week, and the reason I want to make the castor oil now is that it takes a while for the castor oil to soak through. Now castor oil is more considered a compress, and the compress can be used again and again and again and again, many times. Now obviously the ginger poultice and the onion and the garlic, when you've used it, you throw it away. And that's the beauty of this little parcel, is when you've used it, you throw it away. Now, if it's a really good cloth like this one, you certainly can scrape the inside out and wash it and use it again. But I used to always just use the old sheets, you just throw it away. But I'm going to make a castor oil compress. Now, what we've got here is fine wool, and wool is really one of the best. So this is a really good size for the breast. If there's tumours on the breast, it's also a very good size for the chest, if the chest is congestion. I think there was a question yesterday about COPD. I've often got scar tissue there, and that would be good for here. That is also a good one for the size for the abdomen. And why would you put it on the abdomen? You put it on the abdomen for Crohn's disease, colitis, because it'll penetrate deep and help to reduce inflammation. You can use it for constipation because it will help to break down the inside of the colon, the constipation. You can also use it for fibroids. We talked about that in the hormones. So on this area here, fibroids, it'll break up fibroids, it'll break up the cyst for polycystic ovarian syndrome. It'll break up all the little pockets with endometriosis. So I'm going to pour castor oil on there. I am not going to saturate it with castor oil, because if you saturate it with castor oil, it's got nowhere to go. Now I'm going to draw up on, would you like to draw on the book what I've done here, the amount I've put on? What you'll see, I'm not going to hold this up because it's sitting on top, and if I hold it up it'll fall everywhere, but I've made it now because in about 15 minutes it will have soaked through, and then I can show you. But with the castor oil, I have just put about the middle third on, reason I've done that is by the time it soaks through, it'll take up probably another 1/4 of an inch. And then when I put it on my hot body will thin the oil, and so it'll spread out a little bit more. But if I cover that whole compress with it, and put it on my body, it's got nowhere to go, so it'll drip everywhere. So that's about what I've done. And what you'll find is, when it soaks through, it'll take up this much. And when it goes onto my hot body, it'll take up about that much. I was in Ireland and a lady had fibroids, and I said, have you tried the castor oil? And of course the yam cream, because the reason the fibroids there is the high estrogen, and the yam cream, we talked about that gets that estrogen down. And applying this. She said, I'm never going to do that again. I said, why not? She said, the oil went all through my pajamas, all through my bed, all through my sheets, all over my mattress. I said, aha, you use too much. And you can imagine this castor oil, how hard is that to get it out. But if you do it properly, you will not have that at all. Because it's a compress, you can use the same compress again and again and again. So when I broke my arm 2.5 years ago, when it came out of plaster, I couldn't bend my fingers. Now the whole time I'm in plaster, I am wiggling my fingers because I knew I needed to keep them moving. But when it came out of plaster, I couldn't bend my fingers down. I saw a physio and she said, you should be able to do this, but I could not do that. You see, I trod on a slippery rock, my whole body went up and slammed down on my wrist. And I underestimated, and the rock was about, it was a huge rock. I underestimated the damage done to my ligaments, my tendons and my muscles. So what are you going to do? Because I tried, but I could not. So what I did was I wore a castor oil compress on it every night. See, it's very easy. It takes about 10 seconds. I mean, it takes a little bit longer to make, but once you've made it, so every night I put it on, bandage it on. I use the same compress probably for 2 months. And once a week, I'd feel it was getting a bit dry. I'd put about another teaspoon on. And I wore it every single night for I think about 5 months, and I've got full use of that now. In fact, it's no different to my other hands. And as I showed you that question last night with that shrinking of the ligaments, the tendons, I know my husband, his grandfather and father, their hands were creeping up like that because of the tightening of the ligaments there. So we just rubbed castor oil in. It's even better if you can make a compress. You rub castor oil and we have to sit there for 10 minutes. Not everyone's got 10 minutes to rub castor oil. It is so thick and sticky. And that's why the compress is so good. You just put it on, wrap it around. The thicker the compress, the more castor oil it can hold, and then the more castor oil can go into you. It'll break up a bone spur. Obviously not overnight. If the bone spur's been there 3 years, it might take 3 months. If the bone spur's been there 3 months, it might take 3 weeks. If the bone spur's been there 3 weeks, it might only take 3 days. You've got nothing to lose, just keep doing it. Keep doing it. So castor oil can be used on a bunion, on a bone spur. It can be used, I think we talked about the liver, gallbladder, gallstones, at the back, kidney stones. And we also talked about putting it in the eye. One lady had floaters and she put the castor oil in her eye every night for 7 days and the floaters were gone. I've been told by many, especially ladies, that they've been able to break their cataracts up by putting the castor oil in. It's still sitting there. I think it's because it's warm, but it is going through. But while we're waiting for that to do that, we're going to look at potato. So once again, we've made the plastic, we've got the cloth there, and we're going to put potato on. So potato is very good for tissue inflammation. Remember, the ginger is for joint. Potato is very, very gentle. You would never put a ginger poultice on the eye, but you will put potato. It's very cooling, it's very soothing, and it's very gentle. So it's very good for conjunctivitis. I think you call it pink eye. Wear it overnight, you put it on, and you can see the juice coming out there. And you can see that that's more a browny colour compared to your ginger. But the ginger is for joint, potato for tissue inflammation. So it's very good for a sprained ankle. Also ingrown toenail, splinter, very good on a splinter. It was a few years ago I crashed on the creek on my bicycle. I was looking at the trees and didn't realise my wheel had got caught in, and over I went, got a couple of cracked ribs, smashed my cheek. But what hurt the most was this finger, and a big lump. It's an old bridge. It's about 30 years old. A big splinter had gone down my nail. And oh, that hurt more than anything. And I remember my son, he said, "Mum, I'll get it out." Mum. I couldn't bear that. So I just went to bed with a grated potato poultice. Probably a little bit smaller than that one, around my finger. And I slept either way. With my finger up in the air. And the next day there was no swelling, there was no redness, there was no soreness. The piece of wood was still there. It's a really old bridge. And by the end of the day it was starting to get a little sore, so I put grated potato on it again. So I just did this for 3 nights. So on the 4th morning, when I woke up, no swelling, no tenderness at all. And I looked at it and I started to push it and it just popped out. Now if I'd done nothing, what would have happened to that finger? It would have swollen, it would have been terribly painful, and most people don't know what to do, so they go to the doctor. And you know what? Someone's just had a cardiac arrest, someone's just been in a car accident and almost lost their leg. So what do you think your finger's going to be? It's going to be at the end of the list, and you can sit there for 8 hours in the most terrible pain. And what do? Just give you ibuprofen. And yeah, the grated potato poultice, how simple is it? And if it doesn't work, you've lost nothing. It actually does. That is so simple. So the grated potatoes for tissue inflammation. And what you can do with these poultices, you can use them in conjunction with water therapy. So I'm going to give you a quick idea on water therapy. And we've done this many times. In fact, we've helped many treading on rusty nails. And what are we told if you tread on a rusty nail? You've got to have your tetanus. No, there's no need. My kids didn't have tetanus. We lived in the bush. They used to run barefoot through the hills, and sometimes they tread on a rusty nail. And we put grated potato on overnight. What the potato does is it keeps the wound open. Tetanus can only get a hold if it's an internal wound that is healed on the outside and hasn't healed on the inside. But if you put grated potato on it overnight, it'll keep that wound open, and then it can heal from the inside out. But one mother told me that her daughter trod on a rusty nail and it almost went through the top of her foot. She had a grated potato poultice on it, but she said it's still a little bit sore. So I told her to do alternating or contrast hot and cold foot baths. So this is very old remedy. In fact, this is what Dr. Kellogg used to do. All these nurses were trained in this. You know, nurses used to be trained in this. And I'll show you how it works. When you apply hot water to the body, it has a stimulating effect. And we've all experienced that if we're a little bit cold and have a hot shower. It's very stimulating. And after 3 minutes, there's a slowing down or a relaxation. And so then we put the finger or the foot or whatever you're doing in cold water, and ideally you make it cold with a few pieces of ice, and cold has a stimulating effect. And eventually it slows down. The difference is the time. Only takes 30 seconds. So what I told this mother to do, I said, get 2 buckets and put hot water in one, and with the first one, it's just what the child can bear. And put her hand in, put your hand in, what she can bear. Hot water. And after 3 minutes, you put it in the cold water that's got ice in it. Only 30 seconds then. Before it's got time to slow down, you go back to the hot. While it's in the cold, you put a bit of boiling water in to keep it hot. And you do this 3 times. So then the question is, what are you stimulating? You're stimulating blood. And remember, Leviticus 17:11 says the life of the flesh is in the blood because it has red blood cells, and the red blood cells are the carriers of the oxygen. They're also the carrier of nutrients. They're the carrier of water. And they also take away waste. So take away the waste, a very important part of healing. Everything we need, we've got. It's actually all in the blood. But what the blood also contains is white blood cells, so they're your internal army. So it's a very powerful treatment. And in just 15 minutes, how long will this take? 15? We're being generous there. I have seen, and I've seen it many times, you can get sometimes up to 50% pain relief. So this is what I also did with my finger. I did the alternating hot and colds and did the greater potato overnight. So I said to this mother whose child had trod on a rusty nail and a nail had almost gone through the top of the foot, I said, take the greater potato poultice off and do the contrast bars, and then ring me back. Put another greater potato poultice on. She rang me back an hour later. She said, the child's laughing, there's no redness, there's no pain. So what's that tell you? You're on the right track. If she said to me, it's still red, it's still sore, I would have said, well, just go to the doctor, because I'm a distance, I don't know what's happening. So we've almost got that soaking there. You see that there, and it's stretched out a little bit more. Oh, it's still a little bit liquid. So this is where the water treatments can be used. You put your feet in, put your elbows in, your hands, put your knees in. So for ingrown toenail, you do that, and a person can get 50-60% pain relief. That's in 15 minutes. How long does it take? Ibuprofen does kick in. 30-40 minutes. And in the area of pain relief, these contrast bars have been used for centuries. So now the next thing we're going to look at is cayenne pepper. And I mentioned yesterday that if you Google peripheral neuropathy, which is losing the feeling in the feet, it'll say there's no known cure. Well, there is. Yeah. So what Jessica's putting together now is a cayenne pepper compress for the bottom of the feet. So we've got 2 layers of kitchen paper on here, and she's just dotting with her finger a bit of olive oil. We don't someone that's got no feeling in their feet, if you put that foot into the hot water, you can burn the tissues because they have no feeling to know the temperature. And you can't put cold feet into a bucket of hot water. You can put cold feet into a bucket of warm water. So that's again listening. So I visited a lady. Peripheral neuropathy is very common in someone that's had chemotherapy. It's one of the side effects. It's also quite common in someone who has diabetes, especially advanced. So I visited a lady who'd just been on 6 months chemotherapy, and she could hardly walk because she had peripheral neuropathy. She had no feeling in her feet. So because I visited her, I was able to make her 6 of these, and I just folded them over like that and put them in a snap-lock bag for her. And that was enough for her for the whole week. So you put your foot straight onto there and just put a sock on and sleep with it all night. Now she told me that after the first night, when she woke up in the morning, her foot had pins and needles. That's the first sign of feeling coming back into the feet. Cayenne pepper moves blood. So when you put that on the bottom of the feet, you're pulling blood down into the area, and the blood feeds the nerves. And we've had quite a few ladies that have cold feet, and the doctors give them that a name. They call it Raynaud's disease, but it's really just cold extremities. And the body can get into the habit of being cold, so don't let it be cold. You've got to keep that body warm. Perfect health requires perfect circulation, and perfect circulation means that my whole body is the same temperature. So we put these poultices, compresses on the bottom of people's feet with cold feet, and in the morning their feet are warm, which is really nice. But then you've got to keep them warm. Then you get some Australian Ugg boots, sheepskin boots. We'll go to Smart Wool and get some nice woolen warm socks. So it's important to keep the body warm. I have a book at home. It's called Knight's Hydrotherapy for Nurses, and it's the textbook that nurses used to study, because nurses used to study this. It's not popular anymore because it takes time. It's easier to give a tablet than to do the water therapies. But it's a very easy thing that you can do in the home. In my book, Sustain Me, I have a chapter on hydrotherapy, water therapy, simple things you can do at home, and I also have a chapter on poultices. So cayenne, just a little bit more about cayenne. You can put it onto the thyroid for an underactive thyroid, because it will wake up the thyroid. You put it on for a couple of hours every morning, maybe every second day. You can take cayenne pepper internally, as we talked this afternoon I should say. Taken just before the meal, it can boost hydrochloric acid production. If there's a cut, you can sprinkle cayenne pepper into the cut and it'll stop the bleeding. People say if it doesn't hurt, it's already hurting. Jessica had an experience where I was in a meeting, Jessica's in the meeting too, it's at the health retreat when we were in Queensland, and my son Peter, who was 12, was at the window going, and I said, Jessica, go and see what's going on. And Jessica disappeared, and I didn't hear any more, and half an hour later I went back up to the house, and there's William, and what had happened, William's 10 and Peter's 12. Peter had a machete and he was cutting down the old banana leaves, and William would come in and take the ones he cut away. And William thought he'd stopped in that area, and he went in just as the knife came down. So Jessica knew what to do. She just sprinkled cayenne pepper into it, and that stopped the bleeding. And he's got a bit of a scar there now, but I'd say most people would have gone and had stitches. You know, there may be a time for stitches, I recognise that. But on the fingers, it's not very thick. So be an initial tingle, then there is pain. There's no pain after that. We have a friend from Romania, and he just had a chainsaw accident where the chainsaw just touched the side of his leg, so he had a wound about this big. He said, I just ran inside, washed it clean under the tap. He's a registered nurse, and he just put cayenne pepper all over it. And he said, I just couldn't believe how I didn't have pain, because it has an analgesic effect. There's an initial tingle, and then it eases it. Like the flu bomb, if you've got a sore throat, you would think surely cayenne pepper's the worst thing. It'll tingle, but when the tingle settles down, you'll find that the sore throat is greatly reduced. The last thing we're going to look at is charcoal. Charcoal is quite unique in that it absorbs and it neutralises poisons. So nothing else in nature does that. And the ability to absorb and neutralise poisons is called adsorb. You see, it absorbs and it neutralises the poison, and the name for that is adsorb. It's used today in hospitals. They use it to filter blood for dialysis. If someone's had an overdose and they go into emergency, they're usually given charcoal, because once it gets into the stomach, it absorbs and neutralises the poison, so now it's safe. By the way, it takes its way through and out of the body. A lot of people that travel through Asia travel with charcoal tablets, because sometimes having water that's maybe not clean, and that's well known in balmy belly, which is like a diarrhea. It's also advised when you're travelling not to have the salad, because it may be washed with dirty water. So a lot of people travel with charcoal. What Jessica's doing right now, this is the easiest way to do it. Yeah, so seal the top. She's put psyllium husk and charcoal together. She mixed the psyllium husk and charcoal together. She's added water, and she's going to massage that mix. And as she massages it and mixes it, it's already going to be jelly. So you mix it well, massage it, and what she's going to do is spread it out over that plastic bag, and then you can keep it in the fridge. And this is like a little charcoal pack that you can use for a bee sting, for a wasp bite, for a spider bite, for a snake bite, because it will absorb and neutralise poisons. So what we do, and the beauty of this is, and you of course can make twice that amount, so you put it in the fridge, and it's like, so you mix charcoal and water, it goes like dirt and water, it didn't mix very well. But when you put the psyllium, which goes like a bit like jelly, as this has, you put that in the fridge, someone's had a bee sting, you just get scissors and cut an area, cut the edge out, take one plastic off, the other side put straight onto the bee sting. And that charcoal gel is straight on the skin, and you've got the plastic backing, and then you can just bandage that on. So it's very easy, because if someone has a bee sting or a spider bite or a snake bite or a wasp bite, well, they want help very quickly. But what you can do, if you haven't got one of these and you're mixing it up, you can just apply ice to the area. Ice is one of the best anti-inflammatories that we have. And I think I gave the story of when I had jitters and all I did was ice it. So of course you can make twice that amount, but the beauty of putting it in a plastic bag is there's no smell, no mess, because you can imagine mixing this up in a bowl. You've got a black bowl and you've got a black spoon. If you put it in this little snap-lock bag, poisoning, for upset stomach, for diarrhea, for vomiting. It can be used externally for all poisoning cases. I've even known people to do a charcoal compress on the abdomen if they have a lot of bloating and upset there. With these, sometimes you'll alternate your poultices, like for someone with gout or arthritis, they might alternate between the ginger and the castor is a great one for using overnight. And if after a couple of days your problem's still there, it just means that you need to do it a little bit longer. So often people have been sick for 20 years. The good news is it won't take 20 years to get better, but it might take a few years. And sometimes if it's not having an effect straight away, it just means you need to do it a little bit longer. So we're coming to the end of our class, and yeah, already, I don't know if you can see that, already we've got a little syrup there. So if you really needed it in a hurry, there you've got a syrup in half an hour. But ideally, you let it sit for 24 hours and then strain it and just keep it in the fridge. What would be the dosage for an adult? It might be a teaspoon 3 times a day. For any respiratory, sinus, sore throat, coughs, colds. For a child, half dose, half teaspoon 3 times a day. For a baby, just put your finger on it and dot their tongue. But aren't we told not to give children honey? How much did I say? 1 drop. Some people say, but is it safe? Have you seen what they inject into newborn babies' arms? Don't talk to me about safety. So this is a very old recipe. It's been used for a long time. Isn't that nice that we are reviving the old ways? And those old ways are tried and true. Absolutely, in a crisis, a drug can save a life. And when I broke my arm, I was very thankful for the skill of the orthopedic surgeon. I was very thankful for the painkilling medication, so I didn't feel he put my broken arm back into place. But that was once, so that's a crisis. So that's my first broken bone at the age of 70. And you know, when they looked at the x-ray after 4 weeks, they looked at my date of birth, they looked at me, they looked at the x-ray, they couldn't believe how quickly it healed. And I believe the reason it healed quickly is because I give my body the right conditions, which is basically the laws of health. When the laws of health are applied to the body, these simple natural remedies are far more powerful. So whenever my children were sick, when they had a cough or a cold or fever, trod on a rusty nail, or got bitten by a funnel web spider, you know, I had no fear, because I knew what to do. We just applied the charcoal poultice. Or if it was a rusty nail, we tried the potato poultice. What if you apply the wrong poultice? Well, do you know that's the incredible thing about the human body? If you apply the poultice that is not quite applicable, you won't quite get the results, so then you apply another one. But there is a bit of common sense. Again, we wouldn't put the ginger poultice on the eye, but the potato poultice is very gentle, and that is very good for the sore eyes. And also, if men have been welding, and at the end of the day their eyes might be quite red, you can get the potato poultice and they can just lie down on the lounge and put one on each eye. And sometimes they only need to do that for half an hour, and the inflammation and the red will have eased. So potato is for tissue inflammation, ginger is for joint inflammation, castor oil penetrates very deep. It'll break up scar tissue, it'll break up lumps, bumps, break up bone spurs, break up kidney stones, gallstones, breast cancers, tumours. And the cayenne pepper moves blood, brings more blood into the area. And just before we close, I'll finish with one last story. A lady told me this story. My best teacher have been people like you, who've tried different things and given their story. And by the way, no one can argue with your story. This young woman was 30. When she was 15, she was told she had to have a cervical biopsy. I have never had a pap smear and I never will. I have never had and I will not have a mammogram. A lot of those tests are invasive. But Barbara, what if you have a lump in your breast? I would do the castor oil. And that would be a reminder I need to balance my hormones. So there's always something you can do. So this young woman did what she was told. The total trust, so often we live in those princes. And she's now 30 and she was getting very heavy, painful periods. So she had a scan on her abdomen and they found that on her cervix, about a quarter of her cervix was raised in a hard lump. It was the scar tissue from the biopsy that had been done 15 years ago. And they wanted to dissect and take away that hard lump off her cervix. And so she said, thank you so much for your opinion. I'm seriously concerned. And all she did was get castor oil and rub it into her belly button every morning and every night. And after the first month, the painful period was probably 30% less. After the next month, it was 50% less. And then after 4 months, I think she said, she didn't have pain. So she had another scan and the doctor said, I can't believe it, but your cervix is plump and healthy and there's no sign of that there's ever been a mark on it. How easy is that one? Just the simple castor oil. Some people say, should you get your dark or the clear or the golden, whatever. We've used them all and they all work. Now can you see that probably took a good half hour to soak through that. And what you can do is you wear it overnight and in the morning you just fold it up. And then the next night you just open it up and you apply it again. What we've used there is wool. That's probably the best, a very soft wool. You can use toweling. Again, the thicker the compress, the more castor oil it can hold, and the more castor oil can go into you. So thank you so much. I trust you've been inspired by this.